Okay, this is the recording for perfeval3b. So you introduce yourself, ID the patient, wash your hands. Okay, so I'm going to start with inspecting your eyelids. I see that they're parallel, symmetric, they're open and closing completely. I'm then going to inspect your eyelashes. They're upward and outward. Your pupil fissure is almond shaped. It's kind of the shape of the eye. I'm going to look at your eyebrows. They're symmetric. They are evenly distributed hair. Your bulbar conjunctiva is that clear part over your sclera. That's clear. Your sclera is white. I'm going to have you pull down your eyelids and look at your pupil conjunctiva. Okay, that's pink. That's great. I'm then going to come to the side of your eyes with a pen light and look at your corneas. All right, go from the other side. Okay, they look clear and smooth. That's good. I'm then going to look at your iris, which is the color of your eye. Yours are blue and they're round. I am then going to look at your pupil. All right, it looks clear. They look equal, about 4 millimeters. They're usually about 3 to 7, so that's good. They look round. Your eye shape is round / almond, and your eyes look aligned correctly and even. I'm then going to dim the lights and perform 2 tests. I'm going to test cranial nerve 3, which is oculomotor. I'm going to have you put this index card between your eyes, and I'm going to come in from the side with my pen light, and I'm going to look for your pupil to constrict. Okay, and they both constricted, which is great. That's direct and consensual response. Your pupil is constricted from 4 to 2 millimeters. I'm then going to do the corneal light reflex. So I'm just going to shine my pen light right at your nose, and I see that you're both that the light is kind of reflecting off on the same spot on both of your eyes, which is good. All right, and then I'm going to test for your ocular eye movements, or your cardinal fields of gaze, and that is going to be testing cranial nerves 3, ocular motor, cranial nerve 4, trochlear, and cranial nerve 6, abducens. So I'm going to have you follow my hands in the 6 cardinal fields. Okay, they look smooth. That's great. Then I'm going to test for accommodation and convergence, which is cranial nerve 3. So I'm going to stick my pen light in front of you. This is the oculomotor nerve again. I'm going to have you look at an object in the distance, and then one close. In the distance, and then one close. And I see your pupils constricting and then dilating. Dilating and then constricting. Same thing. They're equal, round, reactive. That's great. Okay, next I'm going to move on to your ears. I'm going to inspect the auricle, the tragus, the lobule, and the meatus. First, I'm just going to inspect, and I'm going to use my pen light to look at your meatus to see if I see any cerumen, which is wax, a little is okay, or any drainage, which isn't normal. Then I am going to palpate the auricle, the tragus, the lobule, and the mastoid bone, asking if you have any tenderness. And then I'm going to perform the whisper test, and that is cranial nerve 8, acoustic. And then I'm going to move down to your mouth and tongue. I'm going to inspect your lips, noting the color. Okay, so pink, no lesions, no swelling, they look intact. And then I'm going to grab my gloves and grab a tongue depressor, and I'm going to inspect your buccal mucosa going in a circle. And I'm going to see that it's pink, moist, I don't see any lesions. I'm going to look next to your second molar on top, look at your Stenson stuck. And then I'm going to look below your tongue at the frenulum at your Wharton stuck. And, all right, I see both of those. That's great. All right, I'm looking at your teeth. They look intact. Your gums, no decay, swelling, erosion, no bleeding. I don't smell any halitosis. Just reading something. Also, your ducks, you can say that they have clear saliva. Okay, so now we're going to test cranial nerve 9 and 10, which is glossopharyngeal and vagus. So I'm just gonna have you take this water and swallow. Okay, that's great. That's looking at your glossopharyngeal, cranial nerve 9. I'm also gonna have you open your mouth and say ah. Great, I see your uvula rise. That is with the vagus nerve, cranial nerve 10. I also am looking at your tonsils, and I noticed that they are pink. They're both symmetrical, same color. I'm going to give them a 2+ because they take about 30% of your mouth. I don't see any enlargement or lesions on there. That's great. So, also, when you said ah, I observed for the rise of the uvula and soft palate. Okay, I guess I said that. Now I'm going to inspect your pharynx, tonsils, and your hard and soft palate. I already looked at your tonsils. Hard and soft palate look normal. I'm going to inspect your tongue. Can you stick it out for me? All right, it looks midline, symmetrical. I don't see any lesions or anything like that. I'm going to have you say the words light, tight, dynamite, and that is assessing cranial nerve 12 hypoglossal. All right, great. And now I'm going to move on to neurological, testing your cerebral function. I'm going to have you do the Romberg test, which is having you stand up, hands at your side. I'm going to put my hands around you just in case you sway, eyes shut for about 5 seconds. If you didn't sway, it's a negative Romberg's test, which is what we want to see. Then I'm going to have you tandem gait. Again, which is what we want to see, is no kind of drifting, and that you can do it. And then I'm going to have you do the pronator drift, which is when your palms are out, hands up, and you're going to hold both of them out. And if you're going to hold them up and one doesn't fall, that's a negative test, which is great. Then I'm going to have you do the rapid alternating movements. So I'm going to have you put your palms up, palms down on your thighs really fast. Okay. And then I'm going to have you do you can either do the finger to finger test or finger to nose. So, I'm sorry, that wasn't finger. Finger is when, actually, I'm not sure if that is finger. But anyways, I'll have you do finger to nose, which is when I'm going to have you do, oh yes, that is finger to finger. And I can have you do finger nose, which is going to be touching my nose to your finger as you move it. Okay. Now we're going to go on to superficial reflexes. We're going to do the abdominal reflex. This is when I'm going to have you lie down supine. I'm going to take my reflex hammer. I'm just going to come in from the side near your belly button to see if it flexes. Okay. I'm going to do about 3 each side towards belly button. Then I'm going to have you take your shoe and sock off, lay back, and I'm going to do the plantar reflex. I'm just going to make this little J on your foot. All right. It clenched up, which is great. Now, last but not least, I'm going to do some sensory function reflexes. So I'm going to have you lay back, pull up on your pant legs, and when I press you with this cotton ball, you can just tell me now when you feel it, okay? Just going to do it on your extremities. And now I'm going to do a sharp and dull test. So I'm going to take this paper clip. This is the dull side. This is the sharp side. So you just tell me if you feel sharp or dull, okay? And I would verbalize that I would repeat all of these items on the other side. And that is performance test B.